Here we are going to have another interesting conversation about this important congress. Now I'm going to introduce the Dr. Gerard Prager. He's Senior Past President, IFSO, and also he's a professor at Medical University of Vienna. So far from here. Nice to meet you, nice to talk to you.
Nice to meet you.
So, what are for you the main causes of the obesity? Let's talk about obesity and then we can talk about treatment.
When we look at the history of obesity, you see a steep increase in the last 50, 60 years. And there is no simple answer to that question, but it's clearly multifactorial. Number one, we eat too much highly processed food. Number two, we changed also the amount of food, the intake. And number three, our environment has changed totally, which means our cities are built in a way that does not promote moving around. So we have less activity and a higher energy intake. To break it down to a very simple formula. So more intake and less moving around results in an increase in body weight.
Is obesity genetic?
There is a certain percentage that is genetic, this is true, but only in very rare cases it is 100% genetic. So there is a contribution of your genes, but to say it's all about genetics is not true.
Yeah, it's a very difficult problem because when you go to the supermarket, you only have processing food. When you go, I don't know, any place, you cannot find healthy food easily. So what can we do?
I think this is a very good question. You know, in some countries over the world, governments now begin to tax sugar. So the purpose of that is to reduce the sugar content in the beverages and to promote more healthy food. Also, some supermarket chains try to reduce the sugar content and to place healthy products more visible, so that the customers buy more healthy food. I think these are great initiatives to promote a healthier lifestyle.
What is the situation in Europe or in your country? Here in Chile, we are facing a very important and huge pandemic, obesity. How is the situation in your country and in Europe?
I would say when you look at Europe, you see a certain differences between Northern Europe and Southern Europe. In Southern Europe, we see a higher degree of obesity. In Northern Europe, it's not that bad. But speaking overall, we also see in Europe a clear increase in obesity rates.
Why is not that hard in the north of Europe?
That might have to do with education of the people, number one, but also with the government that tries to regulate more the sugar content in the food, and I think these are important factors.
Let's talk about the treatment.
Yeah.
We are talking about bariatric surgery, and we have now different kind of medicines, pills, Ozempic, GLP-1, etc. What is the main option for the patient for the treatment of the obesity?
When you look back 10 years ago, you had only lifestyle modification. The doctor would tell you train more and eat less, or surgery. 10 years ago, but this has changed totally. Now we have these new drugs, we have less invasive surgical options, we have endoscopic options, which are no incisions at all. So we have different treatment possibilities, and this is the difference 10 years ago. And it depends on the severity of the disease. If the disease, obesity, is only to lose 5 to 10 kilograms, then medications might be the way to go. So kind of a step-up approach. You start with a less invasive procedure or treatment options and go towards more effective but also more invasive treatment options. And I think what is really new nowadays is that we have an interaction of these different treatment options. So it's not about medications or surgery or endoscopy alone, but when to add another treatment option.
I have a question for you.
Yeah.
Because I'm a journalist, I have to learn from you. So what is the relation between hormones and obesity?
Oh, this is a very interesting and exciting question.
For you, because...
Yeah, I think for everybody. And these new drugs, these classes of drugs,
Exactly.
that's what they exactly do. These are hormones. So when you try to lose weight, your body tries to counteract that. How is he doing that, or why is he doing it? Your body wants to preserve you from starving. Because 5,000 years ago, when you lost too much weight, you died. This is not true nowadays. So what is your body telling you on a hormonal level? It will increase your hunger, because your hunger hormone ghrelin increases. And your satiety hormone levels, like GLP-1, will decrease. So you can lose 5 kilograms, but what will happen then? You will feel more hungry and you will feel less satiety. And what will happen? You will regain your lost weight. It's like a rubber band that pulls you back to your original weight.
Let's talk again about bariatric surgery. The new medications, Ozempic, semaglutide is the same name in English, Wegovy, are going to kill the surgery or are not the same?
This is a fantastic question, and as a simple answer, definitely not.
No.
It's complementary. You should not see it as either or. Again, if you have, let's say, 5 to 10 kilograms to lose, then I think a medical treatment options with GLP-1 analoga or something similar is a wonderful and the way to go. But if you have a BMI of 40 or 50, then this is not enough. This is not effective enough. And then you might want to go for metabolic bariatric surgery. It's not only bariatric surgery, it's metabolic surgery. Why? Because this type of surgery has a huge impact on your hormone level of satiety and hunger.
We can have medications, we can have the surgery, but what happens if we don't change our lifestyle?
This is a wonderful question, and it's mandatory. You're absolutely right. It's too easy to believe I take this pill and my entire life will be great again. No, this is not true. It facilitates to change your lifestyle. So if you take the pill and you lose weight or inject the drug, then you should also train on your behavior, on different levels, on your food intake, on eating healthier food, and also to start more daily activity, doing sports, training. And what we all do not enough is train our muscle mass. You should do really some muscle training, because when you lose weight, either with drugs or with surgery, you also lose muscle mass, and that's what we don't want to see. We want to see a same level of muscle mass, or in the future even gain more muscle mass.
This fight is very difficult, because when you talk with, I don't know, a kid, they say, what do you want? A donut or an apple? What do you want? To play with your PlayStation or to play outside? It's very difficult. How do you see that problem? Because it's difficult. Is better a pizza or a salad?
I give an example. In Europe, in many schools, in former times, the buffet offered all these soft drinks with a lot of sugar in it, and also donuts and let's say food that you should not eat as a child. And this has changed. There are now government regulations in many countries that banned beverages with a high sugar content from the school buffets and also promoted healthy food. Saying that, the very interesting thing is that after metabolic bariatric surgery, your perception of sweetness and food changes totally.
Really?
Many people suddenly start and liking, therefore they started eating healthy foods after surgery.
Yeah, because at the end of the day, it's better.
It's better.
That is the way to be happy. Not sugar, no processing food, no sodas. Probably the other way.
You know, sugar promotes a health system in your brain. And I want to give you a comparison. Sugar is like porno for the brain.
Oh my God.
Yeah.
Yeah, so dangerous.
Yeah.
Yeah, it is. What is your main message to our audience according to this conversation?
I think I have two messages. Message number one, obesity is a disease. And people who suffer from obesity should not be stigmatized in the public and in all the life. You don't choose obesity.
No, you don't choose.
Obesity is a disease, number one. And my second message is we have now very effective treatment options depending on the severity of the disease. And these treatment options consist of drugs, consist of endoscopy and surgery.
And what is your expectation about this Congress?
I think we discuss exactly this interdisciplinarity, this new interaction between different treatment modalities. When to start medication, when to go for surgery, or when to combine both treatment options.
But never forget that you have to change your mind, you have to exercise, you have to eat well. This is not an option.
And therefore, this Congress has not only surgeons, but also integrated health.
Yes.
We have a lot of dietitians,
Exactly.
psychologists. This is the multidisciplinary team. As always in life, alone you cannot change things. You need a team, and the teamwork makes the dream work.
Perfect, that is the key. Thank you so much. It was very nice to talk to you.
Thank you.
So I will see you in another interview. Thank you so much.